Chromium is a mineral that's often taken by itself or in combination with other dietary supplements that claim to be useful for weight loss. But does it really help, and how effective is it? Hi, I'm Dr. Brian Young, a naturopathic doctor in Toronto. Let's take a look at chromium picolinate for weight loss. Chromium is an essential micronutrient that your body uses to help break down some of the food you eat. It's involved in food metabolism. Being a micronutrient, your body doesn't really need a whole lot of it to function normally, and it can be found in many foods like meats, grains, fruits, vegetables, and nuts. Chromium picolinate is just a form of chromium commonly used in dietary supplements. Some other forms are available like chromium nicotinate, chromium polynicotinate, and chromium chloride. Nicotinate and polynicotinate forms might have slightly better absorption than picolinate, while the chloride form has the lowest absorption of the bunch. Nicotinate and polynicotinate forms also tend to be more expensive than the widely available picolinate form. In general, oral absorption of chromium is quite low, regardless of the form. Your body just won't absorb most of the chromium you eat, and it's passed out into the stools. So taking either the picolinate, nicotinate, or polynicotinate forms are all perfectly fine for therapeutic uses. How does it work? When we eat our food, our body produces a lot of hormones in response. These hormones do all kinds of things, from breaking down the food to helping us convert it to energy to storing it as fat. Insulin is one of these hormones. It helps our bodies take the food we've eaten and convert it into energy. But there are some people who have problems with this process. Their body produces the insulin but doesn't listen to it very well. As a result, the food is not being converted efficiently into energy. The body recognizes this and tries to correct the problem by producing even more insulin. This creates a problematic cycle in which the body is constantly producing higher and higher levels of insulin, but is ignoring it more and more. But if the food they've eaten isn't being converted efficiently into energy, it has to go somewhere. So their bodies end up storing more of the food as fat rather than using it as energy. We call this problem insulin insensitivity. Chromium is believed to help with insulin insensitivity by helping the body better listen to insulin. The theory is that by having our bodies listen to our insulin better, the more efficiently food will be used as energy and less likely it will be stored as fat. This will also result in a suppression of appetite, since insulin also stimulates feelings of fullness. Side effects. Some people get stomach irritation, especially when taken on an empty stomach, and taking it with food seems to help these people. Headaches, insomnia, irritability, and mood changes are possible, especially with higher doses of chromium, so make sure you aren't inadvertently taking way too much chromium if you're taking a chromium supplement, plus multiple combination supplements that have chromium inside. There are rare cases of kidney and liver damage. However, the vast majority of these cases were in individuals taking far too much chromium. You should watch your daily dosing if you decide to take a chromium supplement. Chromium is typically dosed at a few hundred micrograms. This is mcg. A microgram is 1,000 times less than a milligram, which shows up as mg. Make sure you understand this distinction. If you mistakenly take a whopping 200 milligrams of chromium rather than 200 micrograms of chromium, you're gonna have a bad day. Is it effective? Some evidence suggests that supplementing chromium in patients who have insulin resistance problems like PCOS might help with insulin control and allow their bodies to better respond to the insulin they produce. Unfortunately, this doesn't also seem to translate to a whole lot of weight being lost, with the average patient losing around 1 additional pound over a few months. Also, these beneficial effects only appear to affect insulin-resistant populations. Studies that supplement chromium in healthy, overweight adults find no effect on weight loss. Should you try it? If you're an individual who has blood sugar issues or has insulin resistance problems like those with prediabetes, type 2 diabetes, or PCOS, supplementing chromium might be helpful for your condition. Combining it with the proper diet might help to get your blood sugar under control. However, if you're taking it for the sole purpose of losing weight, you should set realistic expectations for chromium for weight loss. Understand that the amount of weight you might lose on chromium is likely not significant. It's likely to help with insulin insensitivity, so if you don't have any issues with insulin resistance, are perfectly healthy, and eat a varied diet that's not deficient in chromium, chromium supplementation may do nothing for you in terms of weight loss. Also, if you're taking multiple supplements or are getting IV therapy or vitamin injection therapy, make sure your combined daily dose of chromium is not too high, or it could cause you some unwanted side effects. Do you use chromium for weight loss, and how have your experiences been? Let me know in the comments down below. And if you found this video helpful, please subscribe to the channel and leave me a like. Hit the notification bell if you want to stay up to date, and share this video with someone you know can use the help.